Thank you very much, Mr. Chairman. And Nikki Cottrell sends the apologies of the airline KLM that failed to take off from Bristol this morning to bring her to Copenhagen. So I've been asked to give the talk in her place. So I think the Dutch colleagues here bear some responsibility for this.
We are ashamed.
So I've been asked to give this, and this is a qualitative research study embedded within the UNBLOCS trial. And the UNBLOCS trial is about prostatic obstruction, looking at men with urinary retention or bothersome LUTs, and wanting to have prostate surgery. So it's a nationally funded by governmental monies, a randomized controlled trial of TURP versus thulium laser transurethral vapor resection of the prostate. And as I've said, this is an embedded qualitative study. For some reason or other, this is going, oh, it's okay. I'll do it on the other one. This is a very large study. 410 men were randomized in 7 centres in the UK. Half of them presented with urinary retention and had a catheter. The other half presented with lower urinary tract symptoms. And they were followed up for 12 months. Within this study, the qualitative study looked at 37 men, age ranging 61 to 83. And the aims were to look at their experience of having the obstruction, either symptoms or retention, the experience of the intervention, or their post-operative experience. Now, this was a high-quality qualitative study and followed what is a standard protocol. That is, you transcribe a recording of the interview, you put it into a piece of software called NVivo 10, and then you come up with themes. So the men produce various themes, and you continue to sample the population until there are no new themes. So at 6 weeks, they had an IPSS, and again at 3 months and at 12 months. And the interviews were carried out in that period. So the 3 themes, or the 3 areas that were looked at, were the preoperative life, what it was like to have the condition, either LUTs or urinary retention, what happened around the time of the procedure and the immediate recovery, the physical experience, complications, etc., pain, and then what was the final impact of surgery, were they satisfied? Well, there's good news and there's bad news. If you ask about satisfaction with the eventual outcome, both procedures did well, and here you can see 3 quotes. I'm pretty pleased with what I've had done. I would recommend it to my friends. I was only just coping before the operation, and now I don't have to think about it. My happiness is like I'm a new person. I can smile again. The bad news was that the information given by the centres obviously wasn't very good. So one man said the pain was horrendous and I wasn't told about that. Another said, I thought once I was discharged everything was going to be fine, but actually it was quite rough. And the third one was saying, I was hoping something might change because on a lot of questionnaires there were issues around sex. However, you're the first person I've ever talked to about sexual issues. So the conclusions from this qualitative study was that the procedures were good. The patients were generally highly satisfied, but the period of uncertainty was in the recovery. And this was related really to lack of knowledge given to these individual men. And of course, the information you give men before surgery, any patient before surgery, sets their expectations. And if you tell them it's a wonderful operation and there are side effects, then they're not very satisfied. It also emphasized that we're not very good about talking about sex to these men, and that this should be a routine part of assessment. There should be a proper discussion about whether the man is sexually active or not, and that should be recorded. So most of them, as I said, had a satisfactory outcome. And the importance of these qualitative elements to these trials is they teach us perhaps how to do future trials rather better than we've done the existing trial. And certainly, as I say, again, the sexual issue is very important and the men should be offered a discussion on that. Thank you very much.
Thank you. Any questions from the floor? Adrian, at the top.
So, Paul, what theoretical framework did you use to guide in vivo to do the thematic analysis, and how was that done?
I didn't really hear what you said, but I'm guessing that you asked the framework of the interview. So the framework is
the framework to guide in vivo, because in vivo will only pick up themes that it's been asked to pick up. So how was the hypothesis driven to allow that to happen?
Are you asking me the intricacies of in vivo 10?
No, the software does what it's calculated to, but you need to have a hypothesis-driven coding framework to allow it to do the thematic analysis. How was that done?
Can you call Nikki and ask her?
Fine.
I think that would be better.
Right.
I'm the messenger.
Well, I think whatever the test...
But I mean, I do assure you that she has done a lot of this work, and the thematic analysis and the generation of themes, I understand, is standard in this software, but I've never used it. Have you?
Yes, and that's why I was asking you, because I knew damn well you wouldn't know.
And you know Nikki extremely well, so you will know that the quality of her work is outstanding. Thank you for your question.
Well, I think we can conclude that the conclusions are really valid, and we have to tell the patients all information we need to tell to get the consent properly. So I think there's no question about it. Thank you, Paul.
Thank you.
And I think it also helps clinical practice, not only future studies.